Hi, I'm Harlan Krumholz, editor of JACC, professor of medicine at Yale, and I'm here with Ania Jastreboff, also a faculty member here with me at Yale, professor, and also one of the leading experts in obesity medicine. Ania, I want to talk about terminology. Obese people, morbidly obese people. I'm hearing more and more that these aren't words that we're using anymore. We're talking about people with obesity. We're talking about obesity as a disease, not as something that identifies people. Help our audience understand what's the way that we're talking about obesity today when we refer to our patients.
Yeah, great question, Harlan. And I think such an important one. Language is so important, and the words that we use are so important. So we really strive to use person first or patient first language. So to not define the person by a disease, which is so critical. That's not who we are. And so using language such as a person with obesity, a patient with obesity, an individual with obesity, rather than an obese person. In the same way that we would
Let
also
alone a
not,
morbidly obese person, which is really feels
yeah,
pejorative and derogative, right?
exactly. What else do we say? I mean, morbid, that's yeah. What other disease would we say morbid cancer? So really we need to look at how we use these words in the context of other diseases as well, in the same way that we would say a person with diabetes rather than a diabetic. So I think it's really critical. It's really important. We need to ask our patients what words they also feel comfortable with. And so some patients start out and they're more comfortable in terms of talking about weight or carrying extra weight before we get to the understanding that, obesity is a disease and we will help take care of that disease. We'll give them solutions and help them have options in terms of how to treat that disease. But we need to meet our patients where they are and make sure that they feel comfortable and they don't feel judged. And certainly they don't feel like they're defined by their disease.
That's great. I mean, recognizing the stigma, trying to eliminate it, elevating patients, treating them with dignity. Thank you so much. I think that this is such a helpful way to talk about it. Thank you.
And I'll say one other thing, I think compassionate care is important for all patients, but especially for patients with obesity because they have faced so much shame and blame. Uh, it's completely unfair. And so we really need to be especially compassionate with our patients with
That's
obesity.
a really great point. Thank you so much.